So, Rishi, I'm going to get straight into it. So, you want a smoking-free generation. You want to ban the sale of tobacco for anyone age 14 and under, but also limit the availability of vaping products as well. From a medical standpoint, that's music to my ears because I see the effects of vaping and smoking in my patients, whether that's the increase of cancers, heart and lung issues, vascular issues. It's terrible. But putting my cynical hat on, is it just a broad political statement? How are you actually going to action this and make it work on a micro level?
Well, hey, first of all, thanks for having me on your show. I think the first thing to say is, look, there's something I spent a lot of time thinking about, and we have to remember smoking is the single biggest cause of ill health, deaths and disability in the UK. You know that, you see it as a doctor. 64,000 people a year die, 1 in 4 cancer deaths responsible or attributed to smoking. Enormous pressure on the NHS, society, costs £17 billion. And I think, given I'm in this job, I thought I have a chance to do something about that. It's really clear that most people take up smoking when they're young, and the vast majority of people later in life wish they could give up, but they can't because they're addicted and they wish they'd never started in the first place. So if you can stop the start, as it's called, stop people taking it up in the first place, you'd be well on your way to the most significant public health intervention in this country for generations. And that's why we're doing what we're doing. So as you say, if you're 14 or younger, then you will never legally be able to buy cigarettes in this country. So you'll have an entire generation of kids who will grow up not being able to legally purchase cigarettes. And I think that will culturally change how an entire generation thinks about smoking. And alongside that, as you said, we are bringing forward measures to tackle the very worrying rise in youth vaping. Any parent, any school teacher will tell you this is something that's on their mind. So we're going to do a huge range of things to clamp down on that. And at the same time, help existing smokers quit. So we're going to invest far more in smoking cessation services to give existing adult smokers the tools and the support they need to quit. So if you do all of those things, I think we can make an enormous difference to health in this country. I'll give you one small thing which you'll know from your profession. We've been chatting for a minute or two. At least 1, if not 2 people will have been admitted to a hospital somewhere in the time that we've been talking as a result of smoking. That's the impact it has on our society.
Okay, so although you've told me these things and it sounds admirable, on a micro level, on a local level, how do you police and ensure this is actioned? How do you stop an 18-year-old buying their 14-year-old cousin a packet of cigarettes? And how do you clamp down on social media capitalizing and leveraging their platforms to encourage or promote the use of vaping? I know the advertising standards agencies has some sort of nebulous regulations in place to stop or limit the overt promotion of vaping products, but there are loopholes which companies are using right now. So those two-pronged approach, how do we stop adults buying younger children?
How do we tackle the online?
And the online. How do we do that?
Two great questions. So we've thought about both of those. I think the first thing to say on how does this work in practice is we know that it does. So when we raised the smoking age in this country from 16 to 18 a while back, we had all these same questions. But what we saw, though, was over 30% reduction in smoking rates of young people. Similarly, when the United States raised their smoking age up to 21 from 18, they saw something like a 39% reduction.
So just raising that entry barrier.
It really makes a difference. We know that it does. But you're right, we have to make sure that we're enforcing it too. So alongside what I announced, we announced more funding, considerably more funding, for all our enforcement agencies. So the Border Force at our borders, HMRC, who manage the supply chain, and local trading standards and councils, so that they will have more resources to go in and check that shops are following the law, but also they'll have more powers to levy strict fines when people are breaking the law. So look, there's a package of things there on the enforcement side, because you're right, we need to do that, but we know that it has worked in the past. And secondly, on the online side, we've just passed a new law in Parliament called the Online Safety Act, and that gives the government or the regulator more powers to regulate big social media companies and ensure that they are protecting children from seeing harmful content, and that they will introduce age verification services. Now that we need to roll that out, so it's not going to happen overnight, but that will give us the tools we need to protect children, clamp down on some of the things that they're seeing that they shouldn't be seeing, because particularly with vaping, as you highlighted, any parent, any teacher will tell you this very worrying rise in the number of young people vaping. They absolutely shouldn't be doing that, and the way that these vapes are marketed, the flavours, the colours, the packaging, all of
geared
that.
Geared
towards kids, and we do something about that. So we are going to do something about that. So the same law that's going to deal with smoking and creating the smoke-free generation will also have a bunch of measures in it to tackle youth vaping.
And I feel there's a societal cognitive dissonance when we always use the word safe or safer in the same sentence as vaping. Vaping or e-cigarettes is a safer alternative to smoking. And that almost the frequency of us saying that builds this idea and this narrative that vaping is safe. And people recommend other people to vape to get off smoking, which might have some short-term improvements in health. But actually, there is evidence coming out right now to suggest that actually in some cases, vaping may be worse than smoking for specific conditions, like heart disease. How do we, you said you want to limit the advertisement and sale in some cases of these vaping products. How do we go one step further by, similar to how we stopped public smoking, can we stop public vaping to limit second-hand vaping and people inhaling these fumes from second-hand vaping? How do we tackle those things as well? Would that help?
So I think, look, I'm going to defer to the medical experts on this. So I spent a lot of time talking to Chris Whitty, our Chief Medical Officer, and I think if he was here, what he would say is, if you're an existing adult smoker, then vaping is better. Right, and it's better that you vape rather than you smoke, and vaping can be a very helpful tool to quit altogether. And that's why we, as a government and the NHS, we support adult smokers to quit and getting them to switch to vaping, because we think that is a good thing. You're right to say that we don't understand fully the long-term impacts of vaping. I think that's right, because it hasn't been around for long enough. But what we also know, and Chris Whitty I think would be very clear about this if he was here, is that there is absolutely no reason that children should take up vaping at all, right? That is unequivocally bad news. No one should be doing that. And you're right, we've got a bit of a balance here, because, if you're an adult smoker, we want to say to you, look, better if you vape, and we want to support you to do that. But if you're a kid, no vaping whatsoever, and certainly we need to do something about all the packaging, marketing, flavours which are targeted at children, and just make life a bit easier for parents and school teachers, but also ensure that our kids grow up with better health. So we're going to do both things, but as you say, there is this balance, because for adult smokers we do want to support them to stop, and vaping can play a role there.
And over how long do you see this actually taking effect? Because again, these are grand schemes and grand plans, which I'm on board with as a medical doctor. But when will we start to see the effects of these actually take place?
Yeah, so look, we will pass legislation in this parliamentary session, which we announced in the King's Speech just a few days ago. So in this parliamentary session, we'll pass the laws to do this. Then it will take impact over the coming years. And then the modelling that we've published shows that you will be able to potentially halve smoking rates over a relatively short period of time, and then on their way to them essentially being eradicated in society over a longer period of time. So, there's modelling out there that shows this will make a big difference. And I think, look, crucially, we talked right at the beginning about the impact this is having right now. If we don't do anything, something like 500,000 people will die from smoking over the coming decades. And I had a chance as Prime Minister to do something about that, to support the NHS, protect our society, and ensure that our children grow up smoke-free and are healthier and happier as a result. And I thought, well, as Prime Minister, I need to take that opportunity, and that's why we're bringing forward these measures.
Yeah, I think this seems like maybe one step, and it's an ongoing plan, but maybe needs constant reinforcement, because, I'm on board with what you're saying right now in let's get rid of smoking and, have a smoking-free generation. But actually, I feel there needs to be constant goalposts in place to see where we are in a year's time, 2 years' time. But I really see that vaping also is something that is dangerously rising as an epidemic of vaping, and I hope this pledge can actually tackle that in addition to smoking.
Yeah, and we need to move on that quickly, which we are, because I think you've seen a tripling of the number of children illegally vaping in the
and they're the ones more likely to pick up smoking purely by chance of them vaping.
Yeah, so we're going to bring forward those measures very quickly. We're currently consulting on them and engaging with people, but again, it's about tackling the packaging, the marketing, flavours, where they're sold in shops, the role of disposable vapes. All of those things are the things that we're looking at, and then we will bring forward measures which I think will make a big difference, because we've got to do something about that.
Because the vaping as well, that has a massive environmental impact. Just the tens of thousands, maybe millions of disposable vapes with the lithium batteries which are disposed of as well. I can't even imagine the environmental impact that's going to have.
No, yeah, I mean, people have made that point repeatedly, and that's why you're seeing other countries around the world, similar to us, taking action on vaping. So in countries in Europe, they've looked specifically at disposable vapes, particularly for that reason as others. In Australia, New Zealand, Canada, America, they're all looking or have implemented measures to tackle flavours or packaging and things like that. So look, everywhere you look around the world, countries like us are taking action, and we don't want our young people taking up vaping. It is not good, and we need to do everything we can to stop that from happening. That's what I'm committed to do.
Yeah, I'm going to watch with bated breath and continue to be cynical.
Great. Well, look, I'm happy to come back and talk to you about how the plans are developing. But thank you for your support, and please keep pumping up the message. I think I might have some questions for you.
Please, yeah.
Right. So, what is the kind of myth? What is a myth about smoking or vaping that you think people don't quite understand or they get wrong?
I think it's something I just mentioned previously. Actually, I think vaping and smoking are both bad. It's sort of like asking someone, do you want to be kicked in the groin or punched in the stomach? They're both bad, and I can't. Yes, if someone is a chronic lifelong smoker and they go on to vape, that's arguably healthier for them and a healthier alternative, with a plan to then get off vaping as well. But like you mentioned, and as I've mentioned, it's still bad, and it's such a new thing in terms of we don't know the long-term effects of vaping on the human body, because you're essentially ingesting these ultra-fine toxic chemicals, and some of them don't exist in the tobacco smoke as well. So they're equally bad. So I think the overall message is that both are terrible, but if you had to move on from smoking, vaping is okay, but ideally you need to get on to nothing. So we need to look at counselling, nicotine replacement therapies, medical support to completely get you off vaping and smoking.
And actually, that was my next question. What's your best tip to quit, which I think you just highlighted there?
Yeah, I mean, I don't have personal experience of smoking myself, but if you look at the evidence, definitely nicotine replacement therapy, looking at behavioural support, and actually the evidence also suggests there's no difference between completely cutting out and slowly weaning down your dose of tobacco. So both are equally effective in you having a long-term effect at completely getting off smoking.
Okay, perfect. Well, really good to spend some time with you.
Thank you very much.
Thanks for having me.